Could you have one of the top 10 exceptions for not delaying fertility treatment? Stick around and find out. When a couple is having trouble starting a family, they usually approach their OBGYN or family doctor first to see if there's anything they can do to help them. Now, these doctors will give advice, and some of this advice is based on the definition of infertility. A basic definition is that if a woman is under age 35, a couple should be trying for at least a year before defining them as having infertility. If a woman is over age 35, this is cut down to about 6 months. Now, if you've been trying to get pregnant and it's been under a year and you're under 35, most doctors will say, go home and just keep trying. If you're over 35, they might say, hey, keep trying for at least 6 more months before going to a fertility specialist. Where we're going to talk about top 10 exceptions for this basic advice, which frequently is not in the patient's best interest. First of all, exception 1. If a woman is having irregular periods, she may not be ovulating regularly. And if she's not ovulating regularly or dependably, she may just be wasting time. So if you have irregular menses, maybe you should see a fertility specialist sooner. Exception number 2. If a woman has chronic illnesses or is on multiple medications, these really should be addressed, tuned up, and hopefully minimized before trying to become pregnant. A third exception is that if a woman is very underweight or overweight, she might need a little help getting her health optimized before attempting pregnancy. Women both underweight and overweight can have fertility problems, and they should be addressed before you just waste your time trying to get pregnant fruitlessly. Exception number 4, if a woman has a history of a pelvic infection, such as gonorrhea or chlamydia, sometimes it's called pelvic inflammatory disease, or appendicitis. If a woman has had severe appendicitis, she may have scar tissue in her pelvis, and waiting does no good at all. A fifth exception, if a woman is having painful periods or painful intercourse, this is a sign of some underlying problems that should be addressed and may be affecting fertility. Do not tolerate painful periods or painful intercourse longer than you need to. A sixth exception is timing conflicts. Sometimes women or men are on the road, on business, travel, what have you, and you know you may be waiting a year, but you're not having many opportunities to become pregnant. Fertility treatments can adjust timing and optimize your chance of getting pregnant despite conflicting travel. So if you know there's going to be conflicts, go to a doctor sooner, fertility doctor sooner. Seventh exception, and this pertains mainly to men. You'd be amazed how many men can have sex real easy when they're young and they're just having fun, but when it's time to make a baby, they're nervous and things don't work properly. If you notice things are just not working out right, see a fertility specialist. There's things we can do to help. An eighth exception is if the man has serious medical illnesses or is taking multiple medications. These also can affect his fertility, and wasting time is not a good idea in that situation either. A ninth exception is if a man is untested and unproven. You'd be surprised how often men are subfertile or actually infertile despite being outwardly healthy and having normal sexual function. A semen analysis is cheap and easy to do, and if the guy does not have children or there's some other suspicion of a male factor, delaying evaluation and treatment makes no sense at all. The 10th exception, your time is priceless. If you want to get pregnant now, or if you want to have many children, we deal with some folks due to their religious background, their social background, their expectations from childhood. You want a large family. You're allowed to want a large family, and wasting time is not to your advantage. So if pregnancy is not forthcoming, come seek treatment sooner. Do not wait the whole year. And if you're over 35, do not wait the full 6 months if in fact you want to have multiple children. So those are the 10 exceptions that I find are important to heed if you want to seek fertility treatments. Thank you very much. I hope you found this interesting. Thanks for watching my video. Please feel free to comment, like, and subscribe.